Well, welcome everyone. Hello, my name is Julian. Welcome to Friday's Report Out. Great to see all of you on today's Report Out call. Delighted to welcome the paediatric emergency team who are going to report out on their work on improving the patient experience by reducing delays for patients referred from the emergency department to the children's hospital, and this is the 30-day review. So looking forward to hearing from the team on how it's going. So I'm going to hand over to the team. Over to you guys. Thank you.
Hi, good afternoon. I'm Katie. I'm the senior sister in paediatric A&E and also the process owner for this piece of work. So we've had a busy 30 days, lots of positive improvements going through. Which has been great to see, especially as in children's we've begun to get busier and increased acuity. So we're seeing lots of positive changes. Some of that is just by reviewing the departments, and some of that's audit data that we've gathered, and I'll go through that in my following slides. And we've got clear plans in our PDSA cycles for moving forward for the 60 days. Next slide, please. So the first piece of work that we commenced during the Kaizen event was around clarifying and improving our coordinator role. So we'd set up clear signage as to who was the coordinator. We'd got badges and we got contact phones for that coordinator, and we'd also improved our use of our jobs board, our task list, to speed up the observations, so that when the clinicians went to see the patients, then we were ready for plans for discharge or admission. So we've the PFCs, which is the patient flow coordinators in the children's hospital, have done a really good audit looking at the efficiency of the conversations that we're having between the children's hospital PFCs and the coordinator within the ED, and I'll explain that shortly. And we've got lots of formal positive feedback of the clarity of the coordinator role, which was missing prior to this piece of work, with the badge and the carrying of the phone, and that's pretty much embedded now and consistent. And we've improved that use of the repeat observation board that I explained. That still needs a little bit of further embedding, but it's well on the way. Next slide, please. So the PFCs, the patient flow coordinators in the children's hospital, did an audit, and they looked at 132 patients that were booked on the ED system to come into the children's hospital, either to the wards or to the children's assessment area, and as you can see, 111 of those were rated as efficient calls and 21 not efficient. So a little bit of an area for improvement, but really positive there. We looked at a total of the 148 calls that were received and documented for these patients. The coordinator phone was spoken to directly 74 times. This in the past had been a bit of a mixture of whoever happened to answer the phone. So that's great. We're getting to the right person straight away. Spoke to the nurse in charge 15 times, again, useful information from them, and that's right. And then we've still got a little bit of area to improve on that other 59 times of speaking to other people. They felt from that, the team felt that the communication, therefore efficiency, appears to have improved with the introduction of the coordinator contact and phone, and the plans for that is to continue and improve. Next slide, please. So the second piece of work that we did was around portering, and whether every patient really did need to go with a porter from the ED to the children's hospital, and whether we could offer for families that were safe and suitable to go to make their own way there. So we'd set up maps, and we're improving signage, and we looked at, we've gathered some data around that, and 242 during the audit period went to the CAT unit from the Children's Emergency Department, and that's data came from our ED computer system Symphony, and then correlated that with the amount of porters booked on the portering system. They found that 36% of families are not having porters to take them to the CAT unit anymore. That's 36% of portering availability increased. So of the 85 porter journeys saved over a 2-week period, which the team kindly worked out, that would equate to 2,210 porter journeys over a year on average, which frees up a huge amount of porter time and cost saving to the trust. So that's really positive work. Thank you. Next slide. And then the third piece of work we looked at was around the actual point of referral from the PDD clinicians to the CAT clinicians. We reviewed Ken Books, which is our internal daily review for the emergency department, and there were continuing occasions of delayed referral due to the ED team not being able to get in contact with the team unit. We had further conversations around their technology around the phone, and that they've recognised that and changed their phone. And we haven't got the data yet, but we've got some visual observations that is improving since we've clarified a new piece of technology to a new phone for that. And since we last updated the CAT unit have relaunched their QI work stream within their department, and within that they plan to include work on updated referral methods. We don't know where that will take us yet, but that's certainly going to be linking in with this piece of work. And so going forward to 60 days, what we spent a lot of time in the last 30 days really embedding some of these changes, and what we want to do next is really gather some good data to prove that what we're doing is working. Our aim is to referral to leaving the department to go to the CAT unit in less than 30 minutes. So we need to gather the data to ensure that that's where we're heading. We're going to, one of the ideas that came from the original piece of work around the portering was facilities team to perhaps have our own facilities team member within the department to again speed up that portering process and delay those waits for patients leaving our department. So that's a piece of work that we're keen to look into. Again, to further embed that coordinator role in PED and improve the communications with the PFC team. And again, we'll continue that audit and team feedback from that. And then going forward to the 60 days, it's my last day today in post in Children's ED. I'm going on to comment to the corporate nursing team. So using the strength of the PDSA cycles, we're able to give an effective handover to one of my fellow Band 7s in the PDD, who is kindly going to take over the process owner role going forward to 60 and 90 days. That's it. Any questions for myself and Helen Mollard, who is our process process sponsor?
Katie, thanks very much. That's great. Really good to hear the work that you've been doing. You've done a lot in the last 30 days, and I'm sure the team will be sorry to lose you, but I'm sure looking forward to you joining corporate nursing, where I'm sure you'll make a big contribution. So just check questions, comments on this really important work.
Hi Julian, it's James.
Hi James.
Hi Katie. Fantastic to hear about the progress that you've made there. I just wondered how the teams have found this more sort of close working together between the Children's Hospital and ED. And have there been any kind of cultural challenges, and how's it sort of worked with the two departments coming together to focus on this improvement?
Yeah, it's a really positive start. I think we've had our challenges through the years certainly between the ED and the CAT unit as we work so closely together. and this was a really positive start to moving forward. The QI work that the Children's Hospital are doing, we're absolutely getting involved in as well, and that's really great for them to be including us in that work, because it's so important for the flow. We're both the front door to the Children's Hospital, and it's important that that is right, because if that's not right, then the rest of the Children's Hospital doesn't flow, doesn't work. So we absolutely recognise the importance of us working closely together, and this is one of the tools that we're using to improve those relations and improve that patient journey.
Fantastic, thanks Katie.
Great, thanks James. Any other questions? I think I saw your hand going up, Jimmy.
Thanks, Julian. You were quite right. I didn't really want Katie to escape without any questions, but James has got one in there, which is great. Mine was fairly simple. I was just curious about having been involved and done this in a hybrid fashion. So there's even more credit to this team that have taken this on as a combination of teams and a few people on site. So I'm not sure that's come across before, but we all know there's challenges in trying to do that as a hybrid approach. So I was just curious about, before she escapes to the ivory towers that we affectionately call trusted quarters, what a key take home from that event would be in terms of if she was coordinated next time.
Well, it certainly helped me in my interview, I must say.
Be a process owner before you do an interview for a corporate nursing role. There we go. That's a valuable insight.
Yeah, no, I learned a lot. I think I used to work on the Children's Assessment Unit, so I did know some of the teams. There was a previous role, so I knew the team, and so I think that helped. But it was brilliant to bring the two teams together and just get different people's points of view. I think that's always been a challenge, is that understanding of each other's roles. I think the challenges around COVID and having half a team on computers at home, the technology aspect of that was rather stressful and challenging. And definitely when we can, to have that everybody back in the same room would be, having done one of these before as a participant, I think that was great. But the fact that we can still continue doing events like this and making these positive changes whilst we do need to stay apart is credit to the team, and it's absolutely essential to keep going with this work.
Thanks, Katie. Couldn't agree more. Yeah, different perspectives in the same place, so valuable. And well done again for dealing with the challenge that is a hybrid approach, but great that you've got such a lot of great work done regardless. Thanks for that.
Thank you.
That's great. Any other questions or comments? Katie, can I just check, will you have moved on by the time it's time for the 90-day report out?
Yeah, I hope.
Sorry, 60. I mean 60.
Yeah, I'm moving to the workforce team on Monday, hopefully.
Oh, okay.
So yeah.
Who'll be leading the 60-day report out in your place?
There'll be Samantha Verity, who's one of our.
And Sam's on. I can see Samantha. Hi, Samantha. Excellent. Great.
Brilliant.
Great. Well, that's helpful to know, because I'm sure, Samantha, there's plenty, as we've heard, that you're still wanting to do and to take forward. So keen to support you and the team on that. But it's great to see this, and I know myself from visiting the team, this is an issue that I think is really going to make a difference, and it's great to see the efforts that are going into it. So really well done to the team. If you could pass that on for me, Katie, that would be great.
I will indeed.
So we'll look forward, Samantha, to seeing you on the 60-day report out. I know that you'll shout if you need anything from KPO or any of us in the meantime to keep this going. And that was great to hear. So we're actually done ahead of time, thanks to the efficiency and concision of your report out, Katie. So well done. Thanks very much. And I wish everyone a good weekend. It looks like the weather's picked up for us, doesn't it? Which is nice. And thank you very much to those of you who'll be working. And let's see you all next week at the next report out on Friday the 30th of April, same time, same place. Thanks, everyone. Take care.
Thanks, Julian.
Thanks, Katie. Thanks, Julian.
Thanks.